Look, it's 1 week now after Taylor Liberator's decision, and you had quite sort of nasty tethering on the sort of cheek area just behind the nasolabial lines here, and you've seen your photos of the tethering before. Now we're 1 week after the procedure. How are things feeling at this point?
It's unreal. I honestly never expected to have this sort of skin ever again in my life. I had really severe acne, cystic acne, when I was 18, and so that was obviously 10 years ago. And I came to the point of just accepting my skin how it was. But then when I found out about Taylor Liberator, I decided to give it a go, and I've never been happier to have done such a procedure, because I feel like I got my old skin back, and I just didn't think it was possible anymore.
But interestingly enough, though, we scheduled you in for that, because obviously when we put you under the tangential light, we could see that a lot of your scarring was stuck down scarring. And then you were planning to do it, and then you were not sure. Tell me what happened there.
So I started seeing all these comments online, because I think it's quite natural for someone to do a bit of research ahead of a procedure, especially when you're talking about such a sensitive place like your face, where you know, if something happens, you can't really cover it up. You have to live with it for the rest of your life.
Yeah.
And so I started doing research, and although there were plenty of positive comments out there, there were just other comments that they were just scary, of people saying that they never got their face back, that their skin started falling off, that they lost complete sensitivity. So I decided to pause everything, because I just realized, what am I doing? Like, the risks are insane.
Yeah.
It seems as if 80% of people who do this actually have withdrawal effects. And so I asked to put everything on hold, and I took some time to really think about it. But to be honest, at that point, I had already made my decision. I wasn't going to go through with it. And then...
How long ago was this?
This was 10 days ago.
10 days ago.
So
So you had cold feet 10 days, well, a little bit before, 4 days before the procedure.
And then luckily I was, thanks to your team's support, put in touch with a person who had gone through it a couple of weeks before me, and talking to her just really reassured me, and she just gave me a much more I wouldn't say realistic, but a different version from what I was seeing online. And she just reassured me that everything went well with that, whilst being extremely factual about the side effects. I mean, obviously you're going to go through swelling, obviously you might get bruising, but she reiterated that it was the best thing that she ever did. And if you go with a clear mind, as with every procedure that you do in your life, you have to understand that there's always going to be potential side effects, but then you have to also understand that they are quite rare, and some people see them differently. Like, I was terrified that my jawline would disappear, that I would lose complete sensitivity.
Do a little side to side so we can see. Jawline is good. A little bit of fullness where we've done a subcision, but we're only 1 week after.
So
and this is only going to go down.
Exactly.
So in the logical world of chubby cheek syndrome, which was said a little bit sarcastically, obviously, things would get less as time goes on. But it's funny how these people are saying, hang on a minute, you have to wait for the swelling to go down before you see your face fuller. And like, there's not a lot of logic in that. If the swelling is going to go down, yes, that means your face and your cheeks will get less full. And obviously you can see we're well above the jawline, so none of those ligaments and deeper retaining ligaments are destroyed. So given that we're 1 week after now and you're seeing still a little bit of swelling, which is normal given that it was done 1 week ago, are you terrified about your face shape?
No, not at all. And if I would do it 10 times over again, just because the feeling of not being plagued by the scars that I had, it just can't be replaced by anything else. And so my message to people out there, like I understand that some people may have had a different experience, but please just be mindful with the comments that you do put online, because it almost made me not have this level of happiness. And I think it's fair to keep public informed of potential drawbacks or side effects, and every person who will do a procedure will be informed. And I think that's the key. You have to understand the risks and then make a decision on whether you're willing to risk. But with all those online comments, it just seemed like the risk was at 80 or 90%, and I'm just really happy that I listened to my gut and talked to other patients who had positive experiences, because now I'm where I am now.
Perfect. With the comments you're talking about, were these diffuse across the net for multiple doctors across the world doing Taylor Liberator, or was it just particularly focused at my practice?
It was actually focused at your practice. I mean, I did see a couple, but very sporadic ones in the US. But I mean, if you consider that I could only find 2 or 3 in the US, given that it's a procedure that's been going on for, I think, 16
2009.
years. Exactly.
Yeah.
And obviously the pool in the US is quite big.
Yes.
So,
absolutely.
I mean, compared to any other procedure where you hear horror stories, it was quite minimal. The majority of comments were aimed here in the UK, but it's also because I believe you're the only one doing this procedure.
Well, yeah, I do it in significant volume. So
exactly.
all those comments then were directed at my practice.
Exactly, which obviously fueled my concern even more, because I was like, oh, maybe it's not the procedure, it's the doctor. But I just followed my instinct, got support from other patients that went through it, and I'm just so happy to have done it.
Perfect. I mean, there's facts that can't be denied. Like, it's been around for 16 years. If this was something that we were seeing happening, then we would happily abort, change, do things another way. We have no desire to go on and harm people more than we cause benefit. That's against the first part of the oath that we take. So essentially, the first thing we say is do no harm. So how could we allow a procedure that is worldwide performed that would be causing harm in thousands worldwide if it was happening everywhere to carry on? We would change the way we did things. However, from 2009 till probably 2021, 2022, we hadn't even noticed this phenomenon. No one had brought it to our attention. And as you can see, worldwide, it doesn't seem to be a big problem. It seems like a UK-centric problem centered around my practice. So the numbers and the presentation timeline there would say either I've just suddenly started doing something wrong, but we've been examined in technique and things like that. So there's something else going on, really. It can't just be that something that's been around and safe and done the same way world over for a while suddenly becomes a problem. And that's what I'm trying to say. It's sometimes when you see all these scare stories, it puts you off straight away. But when you start thinking, hang on a minute, there's no one in the US talking about this and saying, there's like hundreds of cases happening there. No one in Australia or India or any sort of other major country saying, oh, there's lots of cases happening out here. And there are people doing it in all of those nations. So why would it be a UK-centric problem focused at this? And that's why I feel upset that we are the only provider of that service in the UK, really. We should not stop doing a good job for our acne scarring patients just because some patients are misinforming other patients. Yes, they may feel that their cheeks are fuller, but then if we release their cheek scarring, like I showed you, it's quite obvious why that area popped out. And that's something that you couldn't achieve before, and what you've hoped to achieve now and have achieved now. So stopping people from getting scarring healed or repaired or facial reconstruction done with bad information or incorrect information is not something that I would want to allow to happen, because that stops people from getting proper evidence-based treatments done.